everyone, welcome to Try Right. This is Pack 365, myself Srija. Today we are going to learn about the ICD-10 classification of some of the respiratory diseases. So coming to acute lower respiratory infection. So what does this mean? These diseases affect the lower part of the respiratory tract, mainly the bronchi and bronchioles. So they are mostly caused by viruses, but sometimes by bacteria. So what would be the common symptoms over here? They include cough, fever, wheezing, chest tightness, shortness of breath. So these infections are more common in children, the elderly, and people with weak immunity. So what is the first code? J20. It is acute bronchitis. Means what do you mean by acute bronchitis? It's a sudden inflammation of the bronchial tubes, so which carry air to the lungs. So this is caused by viruses, but they can also be due to Haemophilus influenza. Haemophilus influenza is nothing but it's a bacterium. So this acute bronchitis, it may be caused by a virus and as well as a bacteria. So what are the symptoms of this acute bronchitis? It is persistent cough with mucus, chest discomfort and tiredness. For example, J20.1, it is acute bronchitis due to Haemophilus influenza. So here it is a bronchitis diagram. You can see a normal bronchial tube which is open and clear. You can also see the inflamed bronchial tube in bronchitis. So in the inflamed one, you can see the inflammation, you can see the thick mucus. So whenever it is inflamed, it produces a thick mucus. So this causes the narrowing of the airway, which is leading to the difficulty breathing. So this is about the acute bronchitis, inflammation of the bronchus. Next, coming to J21, what it is? Acute bronchiolitis. So what is the meaning of acute bronchiolitis? It's an inflammation of small airways called as bronchioles. So this is especially found in infants and young children. So what is the cause of acute bronchiolitis? Most commonly due to RSV. RSV is nothing but respiratory syncytial virus. So what are the symptoms of this disease? Wheezing, rapid breathing, coughing, and difficulty feeding in babies. For example, J21.0 code. So next, J22, it's unspecified acute lower respiratory function. So what does it mean? This is used whenever the doctor knows it's a lower respiratory infection, but he cannot identify the exact organism. So whenever the organism is not exact, when they couldn't identify the organism, whether it is a virus or a bacteria. So J22 code is assigned for the unspecified organism. So bronchitis means big tubes, bronchi, the inflammation of the bronchi. Bronchiolitis means small tubes, bronchioles means inflammation of the bronchioles. Both cause cough and breathing trouble, but this bronchiolitis is more common in the small children. So coming to the next slide. So this group includes which group? J30 to J39 code range. So this code range, it includes chronic and allergic conditions that affect the nose, nasal sinuses and also the pharyngeal region. So what do you mean by chronic condition? It's a long lasting. Acute means short term, right? So coming to chronic, it's a long lasting. So these problems often occur due to the allergic reactions, chronic infections and also the structural abnormalities. So what are the common symptoms for these code range diseases? You can see the nasal condition means blocked nose, sneezing, post-nasal drip. Post-nasal drip means, what do you mean by post-nasal drip? Mucus dripping down the throat. So mucus is traveled down to the pharynx. So headache and also difficulty breathing through the nose. So how are codes classified? J30, it's a vasomotor and allergic rhinitis. So what do you mean by vasomotor and allergic rhinitis? So it's an inflammation of the nasal passages due to the allergies and the abnormal nerve control of the nasal blood vessels. So what is allergic rhinitis? It's a most common type and it is often caused by pollen, dust or food. The name itself, rhino means nose. Itis means inflammation. So rhinitis means it's an inflammation of the nose. So what will be the symptoms of vasomotor and allergic rhinitis? Sneezing, runny nose, itchy eyes, and also you can see the nasal blockage. So for the example, J30.5. So the next code, J31. This is chronic rhinitis, nasopharyngitis, and pharyngitis. The long-term inflammation of the nose, the nasopharynx, or the pharynx. So how it is caused? It is caused due to the repeated infections, pollution, smoke, or untreated allergies. So whenever allergy is untreated, so you can experience the chronic rhinitis, nasopharyngitis or pharyngitis. So what will be the symptoms of these infections? They are persistent nasal congestion, sore throat and also the post-nasal drip. For example, J31.1, which is chronic nasopharyngitis. So you have to remember, rhinitis means nose problem, pharyngitis means throat problem, whereas nasopharyngitis means both, it includes both nose and throat. So both nose and throat are involved over nasopharyngitis. So the next code, J32, it's chronic sinusitis. So these ICD-10 codes ranging from J32 to J36, these describe chronic and infectious diseases affecting the nose, sinuses, tonsils and the surrounding areas of the upper respiratory tract. So coming to J32, chronic sinusitis. I already said you chronic means long term. So chronic sinusitis is defined as the long-term inflammation or infection of the sinuses. Nothing but air-filled spaces in the facial bones. So what is the example of this? J32.0, chronic maxillary sinusitis. Nothing but maxillary sinus, where it is present? Maxillary sinus is present in the cheekbone area, right? In the before slide, I have shown you the types of sinuses and where they are present. So maxillary sinus is present in the cheekbone area. So the long-term inflammation is seen in the cheekbone area. So whenever this condition is diagnosed, just assign the code J32.0. So J33, what it is? It's a nasal polyp. Nasal polyp means, nasal means nose, right? So it is a soft, painless, non-cancerous growth. Polyp is nothing but it's a non-cancerous growth. Nasal. So polyp is seen inside the nasal cavity or sinuses. For example, polyp of nasal cavity. So this is usually due to a chronic inflammation. So when polyps are formed due to a inflammation. So whenever inflammation is formed, automatically a polyp is occurred. So whenever a polyp of nasal cavity is diagnosed in the patient's record, so just assign the J33.0 code. And coming to J34, what it is? It's other and unspecified disorders of nose and nasal sinuses. For example, abscess, pharyngeal and carbuncle of nose. So what do you mean by abscess, pharyngeal and carbuncle? So what are the major differences between these three? So what is abscess? It's a pocket of pus. Abscess is nothing but it's a pocket of pus due to infection. Pharyngeal, it's a boil, it's a painful boil. Whereas carbuncle, it's a group of boils. Means carbuncle includes a group of pharyngeals, right? Pharyngeal means boil, carbuncle means group of boil. So carbuncle is nothing but a group of pharyngeals joined together. Here you can clearly see the picture of pharyngeal and carbuncle. So pharyngeal, it's an infection of a single hair follicle. This is one boil. And the right side carbuncle, it's a cluster of boils. That is deeper infection under the skin. It's a deeper infection under the skin. But what is the common point? Both are filled, both pharyngeals and carbuncles are filled with pus. And both are caused by the bacteria commonly. So next coming to J35 code. What it is? It's a chronic disease of tonsils and adenoids. So chronic means long term. So long term infection or enlargement of tonsils and adenoids. For example, J35.1, hypertrophy of tonsils. So hypertrophy is nothing but it's an enlargement of tonsils and enlarged tonsils. So what are the symptoms of enlarged tonsils? You can experience the repeated sore throats, difficulty swallowing, snoring, and also a difficulty in the sleep. So the next one, J36, it's a peritonsillar abscess. So what is peritonsillar abscess? It's a collection of pus beside the tonsil, often untreated. So whenever the inflammation of the tonsils takes place, it is often untreated. So what happens if it is untreated? There will be a pus formed at that place. So this collection of pus beside the tonsil, often after untreated tonsillitis, is named as a peritonsillar abscess. So here you can see a picture of peritonsillar abscess. There is a difference between normal tonsils and peritonsillar abscess. In the abscess, there is a pus form. You can see the pus form around the tonsil. This pushes it to one side, causing the swelling and pain. So this is the difference between normal throat and peritonsillar abscess. And coming to next code, J37. So J37 to J39, these three codes cover inflammatory and structural diseases affecting the larynx. Larynx is nothing but voice box, right? So what it is? Chronic laryngitis and laryngotracheitis. So what do you mean? Chronic laryngitis means long-term inflammation of the larynx, whereas laryngotracheitis means long-term inflammation of the larynx and also the trachea. So what are the causes of this one? Repeated throat infection, overuse of the voice, smoking, allergies, and also the acid reflux. So these are the causes of the chronic laryngitis. So at the right side, you can see the picture representing the normal larynx and the croup. Croup is nothing but a chronic laryngitis. So it shows the normal larynx. It shows in the normal larynx, you can see the normal vocal cords. They open and close smoothly during the speech and breathing. Whereas the inflamed vocal cords, you can see the swollen and red colored cords, which is causing hoarseness and difficulty in speaking. So this is the difference between the normal one and the inflamed one. So J38 code. This is the diseases of vocal cords and larynx not elsewhere classified. So what do you mean by not elsewhere classified? So structural functional disorders of vocal cords and larynx not covered under the other codes. So whatever the structural or functional disorders of the vocal cords and larynx are present, they are which are not covered in any other sections of the J series. Those are covered in the J38 section. So you have to code J38 for the uncovered functional and structural diseases. For example, J38.1, what it is? Polyp of vocal cord and larynx. So what do you mean by a vocal cord polyp? A small benign growth due to a strain or irritation. For example, you can find these condition in singers or teachers. So what will be the symptom? A hoarse or breathy voice. You can also feel the discomfort in throat. So how do you treat this one? How do you treat of the polyp of vocal cord? By giving the rest to voice, speech therapy. You can also go for speech therapy and a surgical removal if this polyp is large in size. So the next one, J39. It covers the other diseases of upper respiratory tract. So it's infection or abscesses in the deep tissues of the throat and neck region. So for example, retropharyngeal and parapharyngeal abscess. So what do you mean by retropharyngeal? Nothing but pus collection behind the throat wall. So retro means behind. So pus collection behind the throat wall. Whereas parapharyngeal abscess means pus behind the pharynx or the throat space. So what are the symptoms? You can see the symptoms like fever, sore throat, difficulty in swallowing, and also the neck is swelled, and you can also find the breathing problems. So what will be the emergency condition? Antibiotics, so prescribed antibiotics and also the drainage. So the down image, the bottom image, it shows the croup. Croup is nothing but it's a laryngotracheal infection which is mainly seen in the children. So this inflamed vocal cords, they narrow the trachea, producing a barking cough and noisy breathing. So this demonstrates how laryngeal inflammation can obstruct the airway. This is all about this slide. And coming to the next one, chronic lower respiratory diseases. So what ICD-10 CM code ranges for chronic lower respiratory diseases? J40 to J47. So what does this range include? They include the long-term or progressive diseases that affect the lower airways. So especially the bronchi, bronchioles and alveoli. So these diseases, they interfere with the normal airflow and the gas exchange in the lungs. So what will be the causes of lower respiratory diseases? They may be chronic inflammation of the airways, obstruction of the airflow, smoking, environmental irritants, and also sometimes like allergies. So let's discuss about the code classification. J40. So J40 is bronchitis. Bronchitis means inflammation of the bronchus. So it is not specified as either acute or chronic. So this is used, this J40 is used whenever the doctor doesn't mention if the bronchitis is acute or chronic. So whenever bronchitis is not specified as acute or chronic, either short term or long term, so J40 code must be assigned. So the next code J41, it's a simple and mucopurulent chronic bronchitis. It's a chronic inflammation of the bronchi. This produces mucus and causes the persistent coughing. So mucopurulent means, what do you mean by mucopurulent? Muco means mucus, right? Purulent means persistent coughing, or it is mixed with the pus due to infection. So mucopurulent means mucus mixed with the pus due to infection. So what is the example of J41? J41.0. It's a simple chronic bronchitis. Next, coming to J42. It's an unspecified chronic bronchitis. So whenever the exact type of the long-term bronchitis is not mentioned, you have to assign the code J42. Means they will give the information that it's a chronic bronchitis. But in chronic bronchitis, there will be the simple or mucopurulent type of chronic bronchitis. So whenever the exact type, whenever they doesn't specify either it is simple or mucopurulent, you should assign the code J42 as unspecified. Okay. So next code J43. What it is? It's emphysema. So what do you mean by emphysema? So emphysema, it's a chronic lung disease where the tiny air sacs called alveoli are damaged. So this reduces whenever the alveoli are damaged. This reduces the surface area for oxygen exchange, so making it hard to breathe out. This is seen in this emphysema is mostly seen in the smokers especially. For example, J43.2, what it is? It's a centrilobular emphysema, means centrilobular means lobules, central part, the central part of the lung. This affects the central part of the lung. You can see a clear image over here, how the normal bronchi and alveoli looks and how the emphysemic lung looks. In emphysema, the walls are destroyed and the sacs became large and floppy, whereas in normal, the walls are not destroyed, right? This is a difference between the normal versus emphysemic lung. So coming to the next one, J44, the other chronic obstructive pulmonary disease, nothing but other COPD. So what is COPD? It's a group of diseases. It causes the blocked airflow and the breathing problems. Means What breathing problems are involved over here? They include the bronchitis and also the emphysema. So this is often linked to the long-term smoking. So whenever long-term smoking is habituated, conditions like COPD can occur. This means a sudden worsening of symptoms like breathlessness or cough. For example, J44.1, it describes the code COPD with acute exacerbation. So the next code J45. J45 is asthma. So J45 and J47. So these diseases cause the long-term breathing problems. So why they cause the long-term breathing problems? Because the narrowing, swelling or damage in the airways occur. So whenever the damage occurs in the narrow, swelling or damage in the airways like bronchio and bronchioles, this asthma occurs. Asthma and bronchiectasis occurs. So asthma is a chronic inflammatory condition of the airways. So these airways, they became narrow, swollen and filled with mucus. So what does it do? It's make hard to breathe. So it is reversible. So these meaning symptoms can improve with the treatment. So what are the causes of the asthma? Allergy, exercise, cold, air and also the stress. These are the causes of the asthma. So symptoms of asthma, you can find the symptom like cough, shortness of breath, chest tightness and also the wheezing. So what is the example? J45.21. What it describes? Mild intermittent asthma with acute exacerbation. So mild intermittent asthma with acute exacerbation means the asthma occurs occasionally but has a sudden worsening episode. So in the left side, you can see the normal lung versus the asthmatic lung. So in the normal lung, it shows a wide airway with relaxed muscles on the normal mucus. Here you can see the normal lining, the normal amount of mucus and the muscles are relaxed over here. Whereas in asthmatic lung, you can find the tightened muscles. Here muscles are very tightened. You can see the swollen lining, the swollen airway lining, and also you can find the excess amount of mucus over here. So whenever this excess amount of mucus is formed, it stops the airflow, it blocks the airflow. So this results in the asthma. So coming to bronchiectasis, J47. So bronchiectasis, it's a chronic disease where the airways became permanently widened and damaged. So the airway is called bronchi. They are permanently widened. They will be permanently widened and there will be damage. So this leads to the mucus buildup, frequent infections and also difficulty in clearing the sputum. So what are the causes of bronchiectasis? Repeated lung infections, cystic fibrosis and also whenever the immune system is poor in defense. So example J47.1, bronchiectasis with exacerbation. So this means a sudden worsening of symptoms like more coughing and mucus. So here you can see the picture of bronchiectasis at the right side. This is a healthy airway and you can also see a bronchiectasis condition. In healthy airway, the airway is narrow and smooth. Whereas here the airway becomes dilated and also it is filled with the mucus which is orange in color. So this mucus, it traps the bacteria and it causes the infection. And next, lung diseases due to external agents. So this covers under the code ranges J60 to J70. So these diseases occur when a person breathes in dust, gases or chemicals over a long period. So especially at workplaces like mines, factories or construction sites. So the harmful particles settle in the lungs, causing the inflammation, scarring or breathing problems. So such diseases are called as pneumoconiasis, means dust in the lungs. Pneumoconiosis means dust in the lungs. So what is the example of the codes? J60, coal workers pneumoconiosis. So it is also known as black lung disease. It is caused by inhaling coal dust in coal miners. So what happens when you inhale the coal dust in coal miners? So that inhaled air, it consists of some dust particles. So the dust particles damage the lung tissue, so which leads to scarring or stiffness. So that results in pneumoconiosis. So what are the symptoms of the disease? Cough, you can experience breathlessness and also the tiredness. So whenever the coal workers pneumoconiosis is diagnosed by the patient, you just assign the code J60. So coming to J61, what it is? Due to asbestos and other mineral fibers. So this is caused by asbestosis fibers. So what are involved in asbestos? Used in insulation. This asbestos is used in insulation, roofing and also the ship building. So these fibers can cause asbestosis, which can lead to the cancer risk. So whenever this disease is diagnosed, so J61 should be assigned. Next, coming to J62. This is due to dust containing silica. So J60 is due to coal, J61 is due to asbestosis fibers, and J62 is due to silica dust. So which is caused by inhaling silica dust. It is common in stone cutting, construction and also the glass industries. So this condition is called as silicosis. So whenever silicosis is diagnosed, the lungs become hard and fibrotic, which reduces the oxygen exchange. So whenever the oxygen exchange process is reduced, it's difficult for lungs to take in the oxygen and also they exhale the carbon dioxide. So for example, J62.0, it is pneumoconiosis due to talc dust. Talc dust is nothing but from cosmetic or ceramic industries. So this image shows pneumoconiosis, the normal alveoli on one side and the dust-filled alveoli on the other side, showing how particles are deposited and causing scarring in the lung tissue. So over time, these changes makes the lungs stiff and less elastic, which leads to the difficulty in breathing. So this is all about today's section, guys. In the next session, you will be learning about another more classification of diseases of the respiratory system. Thank you.